because, as I was saying, as we sort of got onto the podium, back in 1984, I had a job at the Greater London Council, as it then was, where John, of course, was a member. I was a sort of humble employee, but I was actually a now-go shop steward back then, a little bit green around the gills in those days. But the GLC, I think, did great and innovative work. I was in community areas policy, which was one of the bits of the GLC that gave grants to local communities to give local people a voice. I think it was really important work, and of course they got a lot of brickbats back then from the press for things that were described as loony left policies, such as equal opportunities. And now, of course, all that stuff is mainstream. So I really look forward, I very much hope in a few months or possibly a few years to seeing John and Jeremy in government. I really hope that happens. I am, as Hilda said, at London Metropolitan University, where I'm a health and safety officer and I'm also our branch secretary. London Met happens to be in Jeremy Corbyn's constituency, or part of it is in Jeremy's constituency in Islington. We're a university which has an extremely ethnically mixed and largely working class intake of students. We're regularly publicised as having more BME students, black minority ethnic students, than all of the Russell Group put together. I'm not absolutely sure if that's still true, because in fact we've been through a series of management-induced disasters over the years, which together with the student fees policy and everything that's happening in education policy has led to a loss, a quite dramatic loss of students. We had 40,000 students when we started. Now we've got around about 12,000 students, and the Vice-Chancellor has a deliberate policy to bring that number down to 10,000 with the concomitant staff cuts, of course. I teach the psychology of judgment and decision making at London Met, which actually includes work on risk perception, people's attitudes to risk, so it's related, of course, very much to what I do as a health and safety rep. After 18 years working at London Met and its predecessor institutions, today actually is my last day because I'm being made compulsory redundant, together with the branch chair of our UCU branch at London Met. This is packaged by the management as, we're just unlucky to have been caught up in a wider sweep of redundancies. But without going into too much detail, there's been some shenanigans. We're pretty sure, this is a case of victimisation. We're talking to barristers. They think we've got a very good case. UCU so far have been supporting us very strongly with the legal case. Staff at London Met, when you're penciled in for redundancy, you're given the opportunity to, in fact, take a settlement whereby, if you get compulsory redundant, you just get the basic statutory minimum payoff. If you agree to sign a settlement agreement and go voluntarily, they double that. But it means that you can never again say anything critical about the university for the rest of your life. I mean, literally, that is what the agreement says. Mark Campbell and myself are refusing to sign that settlement agreement. I think we're the only two people in the history of the institution that have ever refused to sign that agreement. This summer, the university is going through what I think now is probably the 14th round of redundancies in 10 years. They're going to make another 395 job cuts over the summer, so you can see, very convenient for them to actually decapitate the two lead negotiators for the union just prior to actually doing this. We will still have a committee, a branch committee, branch officers, much reduced. One of those is here today, Christina Payne, sitting in the second row there, so I wish Christina well and all the others. For several years, before I became the health and safety rep, I was involved in a stress working group at the university as a psychologist. The Stress Working Group commissioned surveys using the HSE Management Standards tool into stress. The first of those surveys showed that we were in the red light zone on just about everything, which means, of course, you're meant to take urgent action. Two years later, we had a second survey, which the consultants actually sort of messed up a bit. In fact, I reanalysed the data, and it showed that we were still in the red light zone on just about everything. So there'd been no improvements. The new Vice-Chancellor came in. He took charge of the Stress Working Group, which initially I thought was a positive thing. I thought he's taking it seriously, but of course actually he just wanted to be able to manipulate the agenda. I was constantly at loggerheads with him. All he was interested in doing was packing people off to the gym, giving them healthy eating advice, telling them if they felt a bit stressed. Well, in fact, he actually made a statement saying that if people here feel too stressed, they should go and get an easier job elsewhere. And we wrote to him, we said that was a breach of his duty of care under the Health and Safety at Work Act. He then complained that UCU were forcing him to get waste money on legal advice. Then we got a letter from the HR director on the VC's behalf saying that actually the VC felt that he'd been misquoted. So anyway, other things that I've been involved with as a health and safety rep, I've run a workload survey, a bullying survey. Each of these, of course, showed the kind of dire result that you might expect. All of this got reported back to the management, but nothing happens. You should have seen jaws drop when, at one of my first Health and Safety Committee meetings, I asked where I could get hold of risk assessments. I don't think they'd ever been asked this before. Even the health and safety advisors, the paid people to advise on health and safety, kind of looked at me like, what is this man doing? Asking for risk assessments? But we know that's the bread and butter of what we all do. Together with Christina and others, we've started carrying out inspections of the workplace. We look very closely at the documentation. So the university has a health and safety framework document. I dug this out. Almost everything in it was fictitious. It wasn't happening. There's health and safety advisory groups that don't exist. Newsletters that don't exist. Any health and safety executive inspector who looked at this might think, gosh, they're doing really well, except none of that stuff actually happens in reality. In this last year, in our science centre, we've had several incidents. We've had a light fitting collapse because of flooding. Students had left taps on at the end of the day. There weren't staff there who observed that this had happened. It eventually got discovered by security in the evening. A light fitting collapse could have hit someone on the head. We've had a couple of two or three uncontrolled gas escapes in the science centre near areas where there are normally naked flames. And I got sent some correspondence which was headed potential explosion. I spoke to people, I spoke to a departing technical manager who basically told me there's absolutely no health and safety culture in this faculty. And it's because of the dean of the faculty. He's a bully, he intimidates people, people are too afraid to talk to him, and it just means that everything really has gone to pot. They had a year without a safety coordinator because the guy left because he was sick of what was going on. The technical managers departed for the same reasons. So there are really serious issues other than stress, of course, which need addressing. Just to sort of draw to a close, in terms of what's happening to me, the grounds for my redundancy, everyone was, it's a long story which I can't really go into, but part of it is that we were scored on various criteria, even though we weren't really clear what those criteria were in advance. So we did try to ask them, what are we being scored on? We couldn't get those answers. When I got my sort of feedback, it said, for example, that I hadn't done enough professional development. But actually, I've been on sort of the TUC Stage 1, Stage 2, I've done the in-house IOSH training course for health and safety, I've done other things besides, probably more than most people, but none of that has actually been counted as my professional development. They only count it if it's actually your academic work. I have actually been allowed to go on these training courses. I've been allowed to do inspections. I've had the time to do this, but the time is not accounted for on my workload. So all of the academics get like workload sheets which show how much teaching time you have, how much scholarly activity time you have, it's not been adjusted for any of the time that I spend on health and safety, which in this last year has probably been a couple of 100 hours worth of time. So you can't do the other things that they say you're falling short on if they're not giving you the time to actually do it. So, you know, there's a whole bunch of other things I could talk about. Our lawyers think that we've got a good case, so UCU has paid for us to sort of meet Slater and Gordon in the City of London. They think we've got a very positive case. We're quite confident about it, and I'm sure many people know here how difficult it often is to get your union to take you even to a lawyer's, because it's so expensive, and unless they are really confident you've got a good case, they're just not going to do it. But we still need public pressure. So we've got a campaign going. We're sort of balloting members at the moment, or an indicative ballot, asking about the potential for grey listing, which essentially is a boycott of the university, potentially in the summer. This is really the nuclear option, actually. We really don't want to have to do it, but the threat of it, we hope, will have some impact. But for those of you here who are on social media, I would ask you perhaps to take some time at some point to send a message to London Met Uni, that's at London Met Uni, and it can simply be a simple message such as hashtag reinstate Mark and David. That's the slogan we're using. So Mark Campbell and myself, reinstate Mark and David at London Met Uni, and that's their official Twitter account, so they will pick that up. The Vice-Chancellor is John Raftery. You can email him, j.raftery@londonmet.ac.uk. All of those details are on our sort of website, of course. But I hope that at some point in the future I will be either continue a union job in some capacity, or back in the university, or a university pursuing a health and safety agenda, because this is work that, like you, I really care about very much. It's very important. Thank you.